welcome to this episode of In the Know. So we're focusing on men's health in particular, but today we're going to talk about bowel cancer screening. So first of all, some introductions. I'm Dr Sarah McNulty. I'm the Director of Public Health for Knowsley. I work for Knowsley Council, and I'll just take us round.
So my name's Joe Jenkins. I'm one of the physician associates working in long-term conditions in primary care Knowsley at the moment.
And I'm a patient from Dr Mazzarani up in Kirby, like Joe Ryan.
I'm Mike Fay. My surgery is Rose Heath in Halewood.
Sorry. So like I say, we're going to talk about bowel cancer screening today. So just a few moments, Joe, on bowel cancer and what it is and why it's important.
Yeah, so I can imagine, well, first of all, I think all cancers are important. First of all, I think with all these different diagnoses, the most important thing is, of course, early detection and early treatment. Bowel cancer's something that affects millions of different people in the UK. It's something that's really common and more common than you'd think. We'd see it quite often or suggestive symptoms of that actually quite often in the general practice. Something that can be entirely treated, and the most common signs of it are things like blood in the stools, changes to the bowel habits, maybe unexplained changes to weight. So we're not talking if you've been on a diet and you've lost a few kilos. We're saying everything's completely normal with yourself. You're eating exactly what you did before, exercising exactly the same, but for some reason you're losing weight. Could also be things like night sweats as well, whilst you're at night, whilst you're sleeping. Drenching the bed. You might also you may also have some other symptoms as well, things like mucus in the stools as well. But I think the main take homes there are the blood in the stools, weight loss, and of course changes to your bowel habit.
So we do have a screening program for bowel cancer to try and detect before people get symptoms. So, you know, with cancer generally, the earlier you detect it, the more successful treatment will be. So we do have a national program for bowel cancer screening. So do you just want to tell us a little bit about that?
So generally the bowel cancer screening you should be contacted individually, not by your general practice, but normally through the post. Or the general practice will get in contact with you to make sure that you're doing the bowel screening, but it generally occurs after your 50th birthday. You should be contacted, whereby they'll send you a little package in the post, and in the package you've got a little kit. Do you mind if I just go through what?
That'd be brilliant.
Yeah, of course. So with the kit, of course, when you get it, the main thing is from yourselves, at least, of course, apart from actually doing the test, the most important thing is writing your name and when, of course, the sample was taken on there. So because, of course, if we send a random parcel off, it's going to go to a lab and get binned straight away. So as we mentioned earlier, time is a big factor here. So whatever you can do to minimise that time is really important. When it comes to actually doing the sample itself, it comes in it's a very small tube that you might see. As I say, write all your own identifiers onto it. When you're taking the actual sample, we'd ask that patients take a clean sample. So there's a couple of ways to do it. The way I would normally mention to a patient, and a way that a few of my patients have seen some benefits or managed to do, would be put a bit of cling film kind of under the toilet seat so that you can essentially catch the stool. I know it's not the nicest of processes, but of course we don't want it to be in contact with the toilet water and therefore come under contamination. Otherwise, it could be that you get a small container and do your business into that. Once you've done that, you then take the actual little tube that you get, and there's a small little probe on it, looks like a little stick, which is essentially a brush, and you just run that across the surface of the stool, which is supposed to take a small layer of that, which you can pop back into the container and then send away. They also say that it's important not to take too much as well, so you don't need to cut a bit off and stick it in the container. Only a small amount's needed.
Okay, so as you say, not the most pleasant thing to do, but simple. You have to do it once.
Yeah.
And you send it off, and actually it could really save your life.
Oh, definitely.
So, Mike, you've done the test.
Yes, I have, yes.
Joe hasn't done the test, so this will be interesting. So, Joe, do you want to tell us why you took the test and how it went?
I took the test, exactly what Joe said there is articulated. Come through the post, I was notified that I had to take the test. When I actually read the documentation that comes with the test, it seemed quite easy and quite self-explanatory really on how to actually do it. So actually went and done the test, and I found it quite easy to go through all the procedures, make sure, obviously, for hygiene, you got gloves on, and as you've articulated there before, about making sure it doesn't get contaminated by any chemicals within the toilet. At first I was a bit nervous, I've got to agree, but after that, it just become quite easy to do, really. I don't see... would I do it again? Yes. It wasn't something that I was afraid of or scared, or I just found the procedure and the process quite easy to do, really.
And you'll get asked to do it in 2 years.
Yeah, I'm quite happy to do that. I would really encourage people to do that. Yeah. I think certainly.
I think another one as well on the NHS website is really useful videos on exactly how to do it as well. So even if whatever we're saying isn't resonating with whoever's listening at home, everything that you need to know is on the NHS website. Failing that, just come in to speak to us at the GP, so we can help at least direct there as well.
So your test was negative, wasn't it?
Yeah, it was correct.
Which is great. If someone has a positive test, what happens then?
So there's a couple of things that could happen, and I think first of all it's important to acknowledge that this is all down to the patient. Anything that we say to you, it's a suggestion. You're the boss of your care, and if you don't want to do certain examinations, that's completely fine, and we should then of course react to that. As far as what happens though, if it's a positive fit test, I think it's important first of all to acknowledge what a positive fit test actually means. So what we're looking for here is microscopic samples of blood in the stool, and that can be one of the main symptoms, which is why I mentioned earlier about blood in the stools. Sometimes you can't see the blood, which is why we do the fit test, and it looks for microscopic blood. Now there's multiple causes of that of blood in the stools. It doesn't always have to be bowel cancer. It doesn't always have to be that. So when you go into the GP practice, they'll ask you some questions similar to what we've mentioned earlier, about your bowel habits, about your diet, about weight loss, and so on and so forth. They may suggest a PR examination, which is a finger in the back passage, to look to see if there's anything like hemorrhoids or polyps that could possibly be causing it, and then depending on the answer of that, they would then refer to the lower GI team, lower gastrointestinal team. Most commonly, that's on a 2-week wait pathway. So that would be as a suspected cancer. Now, again, a lot of people get worried when we say suspected cancer, but I think that the important thing is that as a clinician, I'd rather send you and be wrong about that than not send you and be wrong about that, because as we mentioned earlier, time is a massive factor here. So and then of course that's normally the first contact that you have with one of the clinicians will be within 2 weeks. So doesn't mean that you're going to have a scope in 2 weeks time, but it means that the first contact, either whether it be a telephone call or a face-to-face appointment, that'll be within 2 weeks, and then they'll take you from there.
So the good thing about kind of the bowel cancer screening is that what they know about how bowel cancer develops is that quite often it will develop many, many years before it turns into a cancer. It's a thing called a polyp. So a polyp is like a little kind of outgrowth in your bowel wall, and that can create that can bleed slightly, and that's the thing that they're detecting. And the wonderful thing about the bowel cancer screening program is that it can detect cancer before it's cancer, if you know what I mean. So if you treat them polyps, you treat it really, really early. So that's why it's such an effective screening program. So I'm going to ask Joe why you didn't have the test when it was sent you.
I'll have to put my hands up and say I'm on the naughty step here. But as previously stated, you hear that word cancer and you don't want to know. So I've had a look and I've Googled things what everybody does. And if I'm not presenting with any of the other sweating the night or anything like that, and I'm thinking, nah, I'm all right. And it's probably a foolish statement to say when the test is so simple. A little bit embarrassing because you're messing around with stools and all the rest of it. But I stick my hands up in the air and I go, I should do it. I don't know why I haven't. But I can see why people probably don't. Which isn't the right thing to do, because it's you only get one shot at life, and for a simple test, we all should do it. So I hold my hands up and I'll say I am going to do one,
which is brilliant.
Yeah, great.
And you're not alone. About a third of people locally, certainly in Knowsley, don't do the test. So, you know, part of why we're here today is to try and support people to take it up, because it is an amazing offer, and it will detect cancers early, and it will detect cancers before they're cancers, as I've said, you know, and it does save lives. So hopefully we've convinced you today to get the test done. I guess for anyone kind of watching today who has a screening kit unopened at home or has thrown the screening kit away, what would you say to them?
I'd say first of all, ask why you don't want to do it, as you mentioned. Yeah. I think I'd probably argue that I wouldn't say that you're on the naughty step. I think part of it is our job as clinicians to be able to teach you why it's important. You know, nobody blames you for not knowing, because you've not spent years of your life going to university for the most part to study it. I think embarrassment or kind of disgust at the actual act of doing it is commonplace, but I would also argue if you wipe your own backside, then of course you're already in contact with that area as well, and I'd probably suggest that it's one of those things that it's a bit of an investment in your future. You know, it's even if it is positive, it starts you walking down a path to fix the issue before it's an issue, really, and then of course allows you to continue to live the healthiest and happiest life you can for as long as you can. So I would urge anybody who has one at home just to bite the bullet and do it.
Yeah. And I'd also say, you know, if you do get symptoms, then go and talk to your GP, most definitely. So that is, like we've said before, that change in bowel habit, you know, going more frequently or less frequently. If you see any blood, abdominal pain, like you say, unexplained weight loss when you're not on a diet, all of those things, you know, just go and talk to your GP about it. So before we wrap up, is there anything else you'd like to say, Joe? Sorry.
I feel a bit like stupid sitting in like this like room and like listening to the reasons why like I should be doing it. Is it stubbornness? Is it ignorance? A bit of both. Embarrassment? A bit of that. But yeah, I've sort of had my mind like changed now, and for the sake of what, like 5-10 minutes, it could save like my life. So I'm glad I've come. So although I'm part of this like podcast, it's been educational towards me, and I'm glad of that.
And don't feel stupid.
No, not at all.
I think from my personal point of view, Joe, I just say that it, as Joe's mentioned there, it's you're already there half the way anyway. We do that activity most times, at least one time a day, potentially, and I just didn't find it a problem. I just wish more people would look into it that way. Certainly some of the videos online and stuff like that really educates people and breaks down that barrier of dealing in that like in such a personal way, but it's for your own benefit, it's for your own health, so definitely I'd strongly recommend people do it.
Okay, thank you everyone for contributing today.
Thank you.
Thank you.